So in this trial, where we have worked is based on the ALCYONE trial. We know that Daratumumab with Velcade, Melphalan, and Prednisone really changed treatment for transplant non-eligible patients. But then came the Maya trial, where they used continuous Daratumumab, lenalidomide, and dexamethasone, with a much higher PFS. But we believe that this is because back in the ALCYONE trial, patients only received Daratumumab during maintenance. In the GEM-Optimal, what we have done is that in patients that have received an induction with Daratumumab, Bortezomib, Melphalan, and Prednisone, during maintenance therapy, we have included Bortezomib, so they have received both drugs. With this combination, we have seen that the depth of response has increased a lot. More patients have achieved stringent complete response and complete response. And not only that, but by comparing after 1 year of maintenance in the ALCYONE trial, approximately 30% of patients progressed. Here in the GEM-Optimal, we have only seen 5% of progressions, with PFS and OS rates that are well above 95%.